I have a lot of our members that contact me directly, and they say that the patient has researched a certain condition and has sort of come to his or her own conclusion of what the treatment should entail.
Hello, my name is Alasdair McKelvie. I'm Head of Dental Services for Dental Protection in South Africa, and today I have the pleasure of sharing this podcast with Dr. Tinesha Parbhoo, who's Head of Clinical Support at SADA. Hi, Tinesha. Thank you for joining me, and we're going to talk about the Dental Protection Ethics for All event that's going to be taking place virtually on the 17th of October next month. And you've accepted my invitation to join us as a panelist. Before we do that, I just want to ask you a few questions about yourself, about your journey, how you got to this position as Head of Clinical Support at SADA. So tell me a little bit about your undergraduate education. Which school did you go to, and how did you end up being Head of Clinical Support at SADA?
Thank you, Alasdair, and thank you so much for having me. It's really an honor to be here. So in terms of my story, I graduated from the University of Pretoria in 2005 with a Bachelor of Dentistry degree. And then I completed my compulsory community service year, as it is in South Africa, in Witbank Hospital, which is in Mpumalanga, a different province to where I lived in. But I was actually fortunate enough to be placed in one of the larger hospitals. So there I was able to perform more than the classic hospital, the community service hospital would be able to. So I was lucky enough to do restorative and surgical work and some denture work as well. And as well as going out to service the smaller clinics in the area or in that province. Subsequent to that, I then began working as an employee dentist for a number of dental practices. And it was actually then that I realized that if I wanted to open up my own practice one day, I had zero business acumen. So I then embarked on a certificate in business management, which I obtained from the University of South Africa. And I felt like that really gave me more of a solid grounding in the aspects of running a business. And that is not necessarily taught in dental school. So once that was in place, I purchased a dental practice in Johannesburg, and I worked there for the next 6 years. I then joined a corporate health company where I worked as a consultant dentist for that company for the next 4 years. And then that brings me to where I am today. So where I joined SADA in 2021 as the head of clinical support.
So do you do any dentistry now, or do you still own your dental practice, or what's happening there? No?
No. I've actually moved away from clinical work altogether. I sold my practice as well. And I actually find that the position at SADA, it really keeps me occupied to the point where I actually don't have any bandwidth for taking on any other form of work like clinical work together with my family time, etc. And I think if your question to me was, do I miss clinical work at all? Yes, I do miss clinical work, but I think that if I'm honest, the one thing that I miss the most is just interacting with different kinds of people. So you never know what kind of a patient is going to walk through your door and what their story is going to be, etc. So I think that's the part that I miss the most.
I mean, that was the biggest adjustment for me, because from seeing maybe 15 to 20 patients a day every day for 23 years, all of a sudden you're sitting in a different chair.
Yes.
But tell me, what was the best thing about being a dentist?
Is it just one thing?
No, probably not. But tell me, what did you really like about being a dentist? Or maybe you're still a dentist and you probably still think like a dentist, but what would you say was the best thing or the best things about being a dentist?
Well, you know what? If I pinpoint my top in terms of dentistry, it's probably going to sound completely cliched. However, it's restoring a smile, and it's just knowing that you are able to give someone back the confidence to be able to smile in public, talk in public without having any kind of embarrassment or any of that sort. That for me was like the main source of gratification that I got from my job.
That's very similar to what I thought about if you asked me the question in reverse. And it's interesting, Tinesha, once a year I go with my friends on a golfing trip. One of the guys on the trip used to be a patient of mine, and he's got toothache, okay? And he's got an acute pulpitis, and he's looking to me for some help, and there was nothing I could do. And I've lost that magical skill, and the only thing I could do was give him anti-inflammatories and paracetamols, tell him to book an appointment. But it's that magical skill that we've got that we can
Yes.
actually release people from the pain and suffering that they've got from
Yes.
dental disease and infection. And that gave me a lot of pleasure about dentistry, being able to send somebody home and they'd be feeling a little bit better than when they arrived in the first place.
Absolutely, but I think it's also that, and also changing the mindset around dentistry was one of the bigger things as well, because you would often have people that would come to your door, your surgery door, and they would say, "Oh, I don't want to actually come in any further. I hate dentists. I just want to let you know I'm only here because I'm absolutely in pain and cannot survive any longer." And by the time they leave your practice, there's some kind of a shift in that mindset, and that for me was also something that was it was challenging to achieve, but it also brought me a sense of comfort that at least I was able to do that.
I mean, talking about mindset shifts, I mean, that's going to be what we're talking about in your section of Ethics for All. And one of the reasons I want to talk about this subject is I'm seeing dentists being presented with not necessarily more complex procedures, but more complex patients attached to those procedures. And it's kind of growing, but I'm seeing more and more patients who are making conditions around their dental treatment, whether it be they only want one problem sorted when they've got 3 or 4 problems that are all interlinked, or they don't want to pay for any x-rays because they don't think they're necessary, or they've kind of got a global sum of money that they're not prepared to pay beyond. And also we've got the spectre of what benefits are available from their medical schemes as well. So we're sort of seeing this sort of situation where not only is it challenging to do the treatment, but there are so many conditions that the patients are placing on the dentist that make actually doing the right thing very difficult. Is that something that you're aware of? Do you have dentists and maybe even patients contacting SADA and asking for information or advice and help?
Yes, most definitely. We not so many patients. The patients will generally go through the mediator, but in terms of my position, I have a lot of our members that contact me directly, and they say that the patient has researched a certain condition and has sort of come to his or her own conclusion of what the treatment should entail. And when the dentist, provides different options, then the patient actually starts to question the dentist around, are you doing what is clinically necessary, or are you doing extra x-rays, for example, just to make money? That has been a question that has come up a lot. So I think it's a really valid topic that we're going to be delving into that on that evening.
Yeah, we bear that burden, don't we? We've always had this problem of patients thinking we're actually doing things for profit rather than for clinical necessity. But I'm seeing it kind of creeping the other way, where the patient is saying, I'm not actually wanting you to take an x-ray, or I'm not prepared to pay for those x-rays or that investigation or that CBCT scan. And the dentist is they're not being forced, but there is a kind of patient-led directive to say,
Mm.
this is how I want you to approach my clinical care. When actually the dentist is the person who has most of the knowledge here, and the patient obviously has other preferences. But I see the patients driving the clinical direction, whereas we would normally expect the dentist, who is the technical expert, to be driving the clinical direction. And for some that creates problems because they're undertaking or providing treatment with half of the information. And these are some of the problems that we're going to discuss with you and our other panelists when we all get together on the 17th of October. So enough about dentistry. What do you like doing on your time off when you're not thinking about dentists and codes and medical schemes and things like that?
Well, Yeah, I try and stay as far away from that code book as possible because I dream about it at night. But no, to be serious, my absolute favorite thing to do in the world is to travel. I absolutely love discovering new cultures, seeing new cities and how they operate, tasting new kinds of foods. Yeah, I'm Wanderlust should actually be my middle name, to be honest. But other than that, when I'm not a millionaire spending my money that way, then I also enjoy just reading and yoga. I'm a huge fan of yoga just to calm down my busy mind. And anything that has to do with dogs, I'm there. Yeah, those are my top three.
So, what's the best place you've traveled to?
Hands down, New York City, my favorite city in the entire world. It was such a hustle and bustle, and it was like just this city that, like, when they say it's alive 24/7, you don't actually think that it is once until you are there. It was absolutely amazing and the best place I've ever been to.
Okay. Tinesha, thank you for joining me on this podcast. We're all looking forward to the 17th of October. We're not going to
Yes.
give any more secrets away about what we're going to discuss. And all we can say is that we look forward to seeing everybody, members and non-members, anyone who's part of the oral health care community in South Africa can join us, and the details follow this podcast. So thank you very much for your time. See you on the 17th.
Thank you so much, Alasdair. Looking forward to seeing you then.
I've been your host, Dr. Alasdair McKelvie. Thank you very much for listening. Goodbye for just now.